Hello, I'm Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. B2H serves children in foster care or Division of Juvenile Justice and Opportunities for Youth Community Services Supervision who've been diagnosed with serious emotional disturbance, developmental disabilities, and/or medical fragility. Once enrolled in B2H services, a child may continue to receive services even after discharge from foster care through age 21, as long as they are otherwise eligible. In this video, we'll be exploring the details of the Bridges to Health program. The video features an introduction and 6 chapters. This is Chapter 4, What are the services and how are they implemented? Part 3, Family Caregiver Supports and Services and Skill Building. The purpose of this chapter is to help you better understand the B2H program services offered so that you can better inform parents and caregivers and help them understand the benefits of the B2H program. You will also be able to help parents and caregivers recognize how their support is important in the provision of necessary services. Here to help us understand more about B2H and how it works is Isha Hines. Ms. Hines is currently employed at a healthcare integration agency. She has more than 10 years' experience in the child welfare field, working in group homes and as a foster care case planner. Isha, thanks for joining us today. Family and caregiver supports and services enhance the ability of the child to function as part of a family and caregiver unit and to increase the family and caregiver's ability to care for the eligible child in the home and community. Isha, tell us about these services and why they're important.
Family caregiver support and services informs the family and caregivers of resources available to them in their community. It also provides the child with an opportunity to interact and engage in appropriate developmental activities within their community. If we think of our families, sometimes they're in a new community or they're just not familiar with the resources within their community. So the waiver service provider will go with the family or caregiver to a local community center to help them identify the resources that are available to them and their child.
Now, family caregiver supports and services also include family caregiver education and training on resource availability, so they might better support and advocate for the needs of the child and appropriately access needed services. These services may be provided as one-on-one support or interaction and training, or in small groups where the child and/or family and caregivers participate with others who are in similar situations. Tell us about the next service, skill building.
Okay, skill building services provide support, guidance, mentoring, and train the family and or caregiver on appropriate functioning within the community.
And who decides which skills need to be addressed?
The medical consultant, the child, and healthcare integrator will outline what skills will be addressed in the service.
And where is that addressed?
This will be addressed in the detailed service plan, and the detailed service plan outlines the goals and objectives of the service.
Now, could you give us an idea of what some of these skills might be?
Some of these skills include eliminated maladaptive behaviors, so the waiver service provider may help the family in developing a behavioral modification chart. It also includes task completion, enhancing communication, socialization, problem solving, and or money management.
So these sound like a lot of activities that go on just in daily living.
Correct.
Now, how and when are these services delivered?
These services can be delivered any time of day as long as it doesn't interfere with the child's educational process or other needed services, for example, like therapy. And also the service can be provided on a one-on-one basis or in a small group setting.
Okay. Isha, thanks for being with us. That brings us to the end of Chapter 4, What are the services and how are they implemented? Part 3, Family Caregiver Supports and Services and Skill Building. In Part 4 of Chapter 4, What are the services and how are they implemented? We'll take a look at special needs community advocacy and support.